Thanks to everyone who has signed on. We also have a number of people who will be joining us in the records that we're going to post afterwards. So any of the sessions we're doing this week, we are also going to have on the Waypoint YouTube channel. We do want to make sure that as many people as possible have access to the programming this week. A big thank you to Midland Honda and Brissett Concrete and Forming. They are title sponsors for this entire week of sessions, as well as Get Your Mental Health in Motion this weekend. So we hope to see you all out virtually at that as well. The session that we're having this afternoon is being led by Dr. Rob Meeder. And Rob, we are thrilled to have you back. You were great earlier in the week, and I'm glad we have you every day. So today we're talking about autism. And this session is sponsored by HGR Graham Partners. So thank you so much for making this possible. All of these sessions are free this week. We do, though, have a donation link that will be available in the chat. We'll put that up in just a second. And that goes to the COVID-19 Mental Health Relief Fund. And all of the funds from that will support mental health care in the community and help us deal with challenges of COVID-19. So thank you so much. And Rob, I will let you take it away. Thanks for being here.
Thank you. Thanks for the welcome. And good to see many of you back again. It was a real joy doing this yesterday at noon when we talked about anxiety in kids, such an important topic. I think this is an interesting topic. This is one of my favorite topics to talk about, autism. So I'm going to share my screen, and hopefully this works here. And if I do this, we should see my presentation come up. There it is, and we just press play. So we should be good there. If you're, for some reason you can't see it, please say something in the chat or whatever, but you should see my talk here, except we want to go from the beginning, not the end. And so this is the beginning. Okay, I think we're all set now. So autism is something you hear about often, and probably more so in the last several years. I think it has come more and more to the forefront. There have been some changes that have happened in how autism is diagnosed and classified, and there has been an increase in the rates of autism diagnoses. And we'll talk a bit about that as well further on in this little presentation. My goal here today is not to talk for the whole hour. I said this yesterday as well, but to really maybe talk for, I think it's going to take about half an hour or so. And then after that, to open it up to any questions and to any other thoughts that people might have. And maybe we can carry on the conversation a little bit until we wrap up. So yeah, so let's talk about autism. You may have wondered about what is autism exactly, and I think that's a question that we'll try and answer today. Here are some pictures that might give you some clues as to what's going on. You see there on the left is a boy who is not so much playing with toys as he's playing with certain objects and wanting to stack them in a very high stack. Now that can be totally normal play. I'm not saying that is diagnostic, but that in conjunction with some other behaviors would be pretty typical. And the boy beside him has fallen asleep and has lined up his toys in a, it looks like almost like a size type distribution. The big duckies and the little duckies. And, this is also typical. So playing with toys, not really in the way they were meant to be played with. In this way, normally we think about duckies swimming in a lake and maybe things being a bit more of a mess, but this very orderly row of toys would, again, not be diagnostic, but certainly could lead us to question whether there's something else going on. So, and that's what we want to talk about today. And maybe the best way to do that is just to maybe give some example cases of kids that you may know, and some of this may ring familiar with relatives or your own kids. if there's been an autism diagnosis. So this is Sam. He's 2 years old, and he comes to my attention as a pediatrician, as a normal, healthy baby who was born as a result of a normal pregnancy. But he's noted right from the start to be pretty colicky, and breastfeeding is hard, and he's just hard to settle down and to kind of get comfortable. But he develops normally. He walked by about a year of age. His first words were about 14 months. That's still within normal age range. We usually say kids start talking by about 12 to 15 months of age. And some kids reportedly talk sooner than that. But most kids have their first words between 12 and 15 months of age. So 14 months, it's towards the end of that range, but certainly wouldn't set off any major red flags by that point. However, by age 2, he only has about 5 words, and the words that he does have are hard to understand. And so he gets referred to a speech therapist. And by the time he gets in to see a speech therapist, it's a few months down the road. And by age 3, it's recognized that many of his words are really just more gibberish words, and the ones that he does use tend to be used in a very odd way, and almost like repeating words he's heard, or kind of saying words that maybe he feels like makes sense in that situation, but it's questionable whether he really understands kind of what he is trying to say himself. So it's almost like he's using words because those are just what's expected in that situation. So we call that, stereotypical language, and we call that repeating of things where he just kind of randomly repeats things almost without thinking about them. We call that echolalia, like an echo. And lalia means tongue. So echolalia means you are speaking in an echo. All right, then there's another boy here. He's age 7. So he doesn't come to my attention as a pediatrician until a little bit later on. And when you get the story, you find that as a baby, again, he was a healthy baby after a healthy pregnancy. Again, a bit colicky and hard to soothe as a baby. That's what mom reports. And just like the boy before him, seemed to reach his milestones at a pretty normal age. Sitting and crawling, and then standing, and then walking at about kind of 4 to 6, 9, 12 months of age. And speech, in fact, speech was maybe a bit early in this boy. He probably had some words even before he was a year old. As he became a toddler, though, he really preferred certain clothes. It was just if anything had a tag in it, that was really bothersome to him. He never liked wearing socks, so he tends to be barefoot most of the time, and seemed to really prefer putting on the same set of clothes time and time again. Besides being picky about his clothing, he's also a bit picky about his food and his eating, and he really complains when it's not the right chicken nuggets. And it's to the point where his parents are just like, okay, we're going to avoid a problem. We're just going to kind of give him what he wants. Otherwise, he's not going to eat. And so, and they take him, for chicken McNuggets at Burger King, and it's not the same as the ones at McDonald's. And then a big temper tantrum ensues. Also, when he's at preschool, he tends to be more playing on his own. He's happy. He's cooperative, but he tends to play more in parallel with the kids that are there. And when he goes home, he's got some siblings, but he actually prefers to kind of hang out with the adults. When he reaches school age, so he's age 7 now, so he's in grade 2, he's known to be quite smart, actually, especially in math. And he also knows everything about dinosaurs. You ask him any question, he can tell you sort of the genus and species of most dinosaurs and what they eat, whether they're carnivorous or omnivorous or herbivores. He kind of knows what they look like, and he's quick to point out if you say a name wrong or if you don't say it exactly like he's expecting. And he's also a bit awkward around the other kids, and they're kind of a little bit standoff around him because he seems to ignore their personal space. Sometimes he can be very smothering and kind of come too close, and especially with COVID, that can be hard. And he gets anxious and emotional very quickly, so has difficulty with regulating his emotions. He also really thrives when there's a schedule and a routine. If things happen as predicted, Jared's happy. But if a curveball is thrown into the schedule, or he's asked to do something when he doesn't want to or doesn't feel ready to make a transition, he gets really upset. He also really insists when he's playing with other kids on being fair and that the rules are followed. And if, the rules aren't followed, he gets really upset. He really wants to make sure that everybody is doing it the way you're supposed to do it, almost to a fault, to the point where the other kids are sometimes pulling back a little bit, saying like, I don't really enjoy playing with Jared that much because, he's kind of bossy and he doesn't really want to play the game that we want to play. Or if we've kind of, changed the rules a little bit because, there may be more kids involved or we're in a different situation or location now, Jared doesn't seem to be very flexible. So as you can imagine, as you can probably guess, both these kids were subsequently diagnosed with autism. And there are strict criteria for making a diagnosis of autism, and they're defined in a book called the DSM, or the Diagnostic Statistical Manual that's used in psychiatry. And autism is a diagnosis in there. And it really deals with difficulties and impairments in two specific areas. There's social communication. So that's not just speech, but it's also how you communicate non-verbally and how you interpret social cues and how you engage in conversation and engage with other people. And then the other part is what we call restricted and repetitive behaviors. And that can be a lot of different things. So it can be restrictive because of sensory issues. It can be repetitive behaviors, such as like doing something over and over again, sometimes spinning in circles, or being fascinated by spinning things, or flapping hands when excited. Again, none of these things in and of themselves are diagnostic, but when taken as a whole in a big picture and in conjunction with other signs and symptoms, a child would then meet criteria for a diagnosis of autism. If you look at how common is autism, well, the last statistic I read for the United States was like 1 in 54. I know I've got 1 in 84 written down here. It seems to be becoming more and more common. And it seems to be definitely more common in boys than in girls. We're not sure exactly why that is, but that is definitely a pattern that we see. And so if you can imagine sort of an average school of say 250, 300 kids, that there's probably going to be at least 3 or 4 kids in that school diagnosed with autism spectrum disorder. And we'll talk soon about sort of the fuzzy end of that spectrum, because it is a spectrum. And we'll talk about that in a second as well. So when we talk about the spectrum, we talk about, I talk about sort of what I would call sort of classic autism, which is the more kind of severely affected kids who really show all the features we typically associate with autism, like difficult, like nonverbal sometimes, or if the speech is there, it's very, gibberish and very stereotypical and repetitive. So it's really not very functional speech. And they might have very repetitive behaviors. They might actually have intellectual delay as well, because their learning is so impaired because of some of these difficulties. And then the other side of that spectrum is more what we call the high functioning side, or high functioning autism. It used to be called Asperger's, and that's that high functioning end of the autism spectrum. We'll get into that spectrum a little bit more in a second. What has really been talked about a lot is what causes autism. What's responsible for this rise in rates that we are seeing? Do we need to be alarmed? Is there something going on in our environment? And to be honest, we don't really know the exact cause of autism, and there's probably multiple factors involved, and maybe even different factors in different kids that leads to different expressions of autism and where you end up on this autism spectrum. We do believe, though, that there is a strong genetic component. We know that because if you have one child with autism, the likelihood of another child, of one of your other children with the same parents, of course, the likelihood that they might be affected is actually much higher than the general population. Although what we do see a lot is that you might have one sibling with, severe autism and one with a mild case of autism. What we also see is that when we look at the parents of these kids, we often see some autistic traits, if not an overt diagnosis in the parents as well. The other thing we know is that when there's identical twins, for example, then we've got, rates of 70 to 90%. So if one twin has it, then the identical twin is very to have it as well. But note, it's not 100%, right? We know that they share 100% of the genetic material, yet the diagnosis of autism is not 100%. So we know there must be other factors as well. But genetics obviously plays a big part. And we do some genetic testing when we make a diagnosis. But is there something in the environment? Well, we do know there's other things in, for example, in pregnancy, certain infections, the use of certain substances and medications can actually cause autism syndromes. So kids might have autism if one of those conditions existed before the baby was born. Is there certain toxins in our environment that might cause features of autism and an autism diagnosis? We're really looking into that, and that is quite possible. So why are rates increasing? Well, one other factor that we need to take into account is that, rates are increasing as well because the way we diagnose and our criteria for diagnosis have somewhat widened over the years. So whereas in the past, somebody might be diagnosed with, intellectual disability or another sort of pervasive developmental disorder, now many of those kids would get lumped into the autism spectrum. And that spectrum has become quite wide. And so kids who may not have been diagnosed, say, 20 years ago, or even as recently as 10 years ago, now meet criteria for autism. And so the basket that we use now for diagnosis has grown over the years. As a result, more kids are getting diagnosed, and so it might seem like it's more common, whereas really it's a lot of it is due to just how we classify children who present with features of autism. This slide is just to point out that, when we talk about those blue bubbles in the middle there, social deficits, repetitive behaviors, and language impairments, those are sort of the core symptoms of autism, how it does overlap with many other neurological issues and psychological issues and even physical issues. We know, for example, if you look at those two sort of tan circles near the bottom, there was this immune dysfunction and GI disorders, so gastrointestinal disorders. We know that that's more common in kids with autism. They're more likely to have, stomach problems and bowel problems as well. People have searched hard for a link between, say, celiac disease and autism. There was some controversy recently about autism and the MMR vaccine and how that could infect, the bowels as well. This whole linkage was proposed, but has since really been disproven through numerous studies, but unfortunately has caused a mistrust of some vaccines as well. So that's one of the controversies around autism. But again, so intellectual disability is often seen with autism. Kids tend to be more prone to seizures as well. So we do look out for that when we diagnose children with autism, these related conditions. As I mentioned, this is that spectrum that we talk about. So where, the quote unquote classic autism is the nonverbal or limited verbal or non-functional speech, repetitive behaviors, and lack of eye contact being the hallmark of that. Those kids do need substantial support. And as a result, we classify them as a level 3 diagnosis, okay? So when you hear about people talking about level 1, 2, or 3, that generally refers to the amount of support that's required for them. So a child with a level 3 diagnosis would require support both at home and at school, and would require pretty intensive support and intensive intervention to keep them, safe and to help them gain skills and to work on their skills and for supervision. So those kids would not require substantial support, whereas on the other end of the spectrum, that more high functioning end, many of those kids and adolescents and adults need minimal, if any, support. And I'll talk about that in a second, about how we might want to view this end of the spectrum as not so much a disorder as a difference. So in this end of this spectrum would have, kids with restricted interests and unusual language, sensory difficulties. They're known to be very black and white, to lack a filter. And when they talk, they kind of just say things as they are without really even thinking about the consequences of it. They're very truthful in many ways, and have difficulty with just sort of, maybe modulating what they say based on the situation, like we might commonly do. So, so those kids would be considered on the higher functioning end of the spectrum. They still often need support, but less so than the kids on the other end of the autism spectrum. And that's why we call it autism spectrum disorder, ASD. So these are just some pictures of kids that are or things that people that we think have autism. We all many of you may have seen the movie Rain Man. That's more of a depiction of a pretty specific type of autism, with where Dustin Hoffman plays a character who has some real exceptional skills. In his case, counting cards, which gets him into trouble at a casino. And his sibling, who's played by Tom Cruise, and who struggles to really maintain a relationship and sees also the beauty in his brother. But that is actually, a very small subset of kids who present in that way, with those sorts of traits. And then on the other end, we see people of various descriptions, who are thought to have the more high functioning autism, and some individuals not so great, like some dictators in that list there, but also some real genius people, Bill Gates and Albert Einstein. And again, this is more sort of armchair psychology. I'm not saying that these people have disclosed diagnoses, but there certainly has been discussion about whether they fall on that autism spectrum disorder spectrum. The one person there that you see in that picture there, that's actually Borat. Now, he's not on the autism spectrum, but I'll tell you a very interesting thing about him. His brother is actually one of the most famous researchers in autism. So Borat, of course, Sacha Baron Cohen. His brother is Simon Baron Cohen. He's actually a professor at Oxford who's done a huge amount of research in the autism field and highly respected in the autism field. So it's a very interesting connection. I would love to interview him sometime and ask him about his family, because that would certainly be an interesting conversation. The other person there is a psychologist that I've used some of his material, Tony Atwood from Australia, who does a lot of work with kids who have been diagnosed with Asperger syndrome. So just to clarify, so Asperger syndrome is a word we used to use. It used to be a separate diagnosis. It's now been lumped into the autism spectrum as well. And so it is not, it's a word that I still use, that is still used in a public, in a more colloquial sense, to refer to that high functioning end. And, both of those individuals, Tony Atwood and Simon Baron Cohen, have talked about whether this end of the spectrum really needs to be viewed as more of a difference as opposed to a disorder. There's sometimes pros and cons in viewing it in either way. Sometimes to get resources and to get help, we need to identify day-to-day dysfunction. As a result, it would qualify as a disorder. Sometimes people are entirely happy having features of high functioning autism or Asperger's syndrome, and they don't feel like they need to be specially identified. Having said that, most studies have shown that if people really fall on that end of the spectrum, most individuals actually welcome that diagnosis as at least being an explanation for why they are the way they are and why they might be having difficulties in certain areas of their life. So, but again, with that fuzzy end of that spectrum, we start to blend into normal, and that border there between high functioning and neurotypical is actually pretty fuzzy, and we could see even individuals kind of shift back and forth across that border from time to time. So that's an interesting thing about autism that I like to think about a lot. A lot of words here. I'm not going to repeat this, but these are quotes from Simon Baron-Cohen. I'll just read the first line there, which sort of talks about, individuals who would meet criteria for that high functioning autism. He says, in the social world, there is no great benefit to a precise eye for detail, but in the world of maths, computing, cataloging, music, linguistic, engineering, and science, such an eye for detail can lead to success rather than failure. And this is felt to be a real strength for kids that are and individuals that are on that high functioning end of the autism spectrum. They have a real eye for detail and minutia and sensing differences in things. And that's why, these specific areas, math and computing, tends to have a high number of individuals who are on that autism spectrum. I did physics at Waterloo, and I know for sure in my class, looking back retrospectively now, that some of those people in my class would have probably met diagnostic criteria for high functioning autism, and they were super smart when it came to things like physics and computing and mathematics. You kind of think about probably because many of the math is just so black and white. I mean, it's right or it's wrong. There's not much fuzzy in mathematics. I mean, it's black and white. And same with computing. It's binary. It's 0 and 1. And I think that really appeals to how a brain of somebody like that would work. So I think that's really interesting. And actually now many companies are seeing the strength of that and really look for people with those particular skills and have employed people who are on the autism spectrum because they have such unique skills and talents. Again, this is Tony Atwood. There's lots of words here, but I thought I would just kind of distill out the more salient features here. They don't necessarily have a defective way of thinking, but there's a different perception of situations and experiences. And these people are very creative. They have focus to detail. They often speak their mind, which can definitely have its pros as well, and a strong sense of social justice. All right. So I remember what I said was that, Jared in our example was very fair. There can be some real benefits to that in our world, people to really point out like, hey, listen, that's just not fair. That's just not right. And sometimes we need people to point that out. They may enjoy solitude, and often they're very loyal friends. And this notion that they have less empathy is actually generally not true. They can be very empathic and have very strong feelings towards others and for others as well. So, but there are some difficulties as well. Sometimes with social communication and socializing can be very difficult. Social anxiety is more common in kids that are on the high functioning end of the autism spectrum. And so there might be more emotional outbursts and anger, difficulty with regulating emotions as well, which can be problematic in social settings. So just zooming back again and coming back to just diagnosing autism. How do we diagnose autism? Well, it is really just observation and an assessment of what we see and what's reported to us in the case of young kids. And there are a set of criteria in that manual that I mentioned before, the DSM-5. There are some screening tests which are helpful, but screening tests are just that, they're screening tests. They don't make or break a diagnosis. So there's one called the MCHAT, there's one called the CAST, the ASQ, the SRS. These are all acronyms of different screens that are out there that you may have come across. We do try to screen most kids now at about 18 months to 2 years to see, if they're showing some early signs of autism spectrum disorder, because we know that early diagnosis can lead to earlier intervention, which can have bigger impacts and benefits down the road. So there's been a real push to try and get kids, assessed earlier, and doing some screening in your family doctor's office can often be helpful in identifying kids who are showing maybe some more subtle signs that we should look into further. To actually, help with a diagnosis, sometimes we put kids through an assessment called an ADOS, okay, which stands for Autism Diagnostic Observation Schedule. So an ADOS might be administered with a speech and language therapist who just puts the child through a certain specific set of situations. So, for example, on the picture there, you see a child who's putting puzzle pieces on a template on a piece of paper, and the test there is not so much like can he fit them on a piece of paper, because the outline is pretty clear there, and the puzzle pieces fit in pretty good. Most kids can do that, but more about like whether because there'll be some pieces missing, and how does the child request extra pieces from the test administrator, in this case, the woman sitting there on the right side there. And does he just go ahead and grab it from her hand? Does he not ask at all? Is there eye contact made when that happens? So that's just an example. And we put kids through maybe 10 or 12 of these scenarios, and we look for those clues about how communication happens. We look for unusual sensory interests. Or does a child lick the puzzle pieces, for example? Or does he examine them at really close range to the point where the point of the puzzle is lost, and we're just seeing the puzzle pieces as random objects almost to be examined? Spin them around, or does the child even not engage at all, or become upset even with a simple activity like that? So that's how the ADOS is administered, and then some scoring is done. Again, it's somewhat subjective, and it never makes or breaks a diagnosis, but it would be very helpful in supporting or ruling out a suspicion of autism spectrum disorder. After a diagnosis is made, we provide a letter of diagnosis, which is useful for when other services are called upon to help with a child. We connect patients to the Ontario Autism Program, which provides funding, and that's actually, it's in constant flux. The Ontario Autism Program has been through a number of iterations, even in the last few years. So, but really, it does. It seems to be somewhat political as well, and it does provide support for families of children with autism to get funding so that they can access some of the specialized services that are beneficial for children with autism. We often do some investigations, including blood work. We want to rule out things like hypothyroidism or lead toxicity if we're worried about exposure to toxins. We'll often do some genetic testing too to see if there's any sort of micro deletions or duplications which have been associated with autism features in other children. So those tests are getting more and more accurate, and as we find out more and more about the genetics of autism, those tests will become more useful, just to kind of help us pinpoint a cause, but also to be able to counsel around, like, can this be passed on, or what are the odds of maybe another sibling having autism as well? Generally, we don't do anything like brain imaging, an MRI or a CT scan, a CAT scan, although we do know there are some brain differences in kids that are on the spectrum. Routine imaging has not shown to be of any use other than maybe for research purposes. So it is not normally done. So there are actually very few objective tests, and really it is all a lot of subjective analysis of a child's behavior at home and at school and in the assessment center. We then help families access resources. If they're not in school yet, there's preschool speech and language therapy, occupational therapy, physiotherapy, and then in school, those services shift over to the school board generally. There's also private services available that the families could access using some of their funding, and then other aspects of treatment would be available as well. So here I mentioned speech therapy, OT, physiotherapy. There are behavioral therapies as well, which look at some of the more difficult behaviors that we see in children who have autism, and how can we modify that behavior. So that's sort of a stimulant operant type model of behavior modification that therapists are trained to analyze, and then address some specific difficulties that children with autism are really struggling with. We do believe that starting out earlier, when the brain is still very open to new pathways, that the outcomes are generally better. And then lastly, sometimes for some of the more problematic behaviors, medication might help. They don't treat the core symptoms of autism, like the lack of speech and the social communication and the restricted and repetitive behaviors. There's no medication that would reduce, say, hand flapping or spinning in circles. But sometimes the anxiety can be helped with some medication. Some of the more aggressive outbursts can sometimes be helped. But all these medications, like I said yesterday too, they all have side effects and should be used very carefully. And really are never the first resort. They're usually, we try other things first before we consider the medication route. So what to expect? Well, like I said, for many kids, those core symptoms do improve with therapy and with treatment. And the more they improve, the more positive experiences a child has. Positive experiences beget positive experiences, and so relationships tend to thrive when symptoms are improved, and so that's good for kids' social development. And for some of those kids who are more on that, higher functioning end of the spectrum, I've seen some kids who met diagnostic criteria when they were maybe, 5 or 6. When I see them back in the teenage years, it's pretty subtle. I don't think I would have made the diagnosis if I would have seen them later. And so sometimes we end up modifying the diagnosis. We also see kids shift from being, say, a level 3 or level 2 diagnosis to being like a level 2 or a level 1 diagnosis. In other words, less and less support is required, and a shift in levels is appropriate to give a more accurate description of this child's needs. So sometimes so that does happen, and we generally see language skills do improve and social skills do improve. However, it's hard to predict what the ongoing level of support might be. It's generally kids who have higher intelligence to begin with and have more developed language skills early on tend to do better. But again, it's quite variable. It's difficult to predict, but we do know that kids with more severe autism will likely need ongoing care and support in the community, in their families, and in their community, and at school, and then occupationally later on in life. That's all I had. I'll say thank you there, and I'd be happy to respond to any questions. I will stop sharing my screen. For some reason I've lost my cursor here, so I'm not sure how I would. Oops, nope, don't want that. I think I've hit the right button there. There. Okay, so are there any questions there? I'll go to the chat for a minute and see here. Okay, what local support exists for families with kids and with autism? So yeah, sorry, I should have put that down. So obviously there's lots of online resources. So Autism Ontario, Autism Speaks, Autism Canada. Just Google those and you'll find the online support groups there. There are some local agencies as well. So Carey's Place, which is based, I think, in Newmarket. And there are chapters of each of those organizations that I mentioned just now as well, locally, that you can connect with. From a therapy perspective, so RVH has speech and language therapy services in various communities regionally for kids who need speech therapy. And there is therapy that happens here in Midland at Common Roof. And so there are speech therapists there from the RVH Speech and Language Program as well. In Aurelia, it's at the Common Roof there. I think it's called One Roof in Midland. I always get the roofs mixed up. But and then in Muskoka area, One Kids Place is the area. So is the agency. So those are kind of the local resources for younger kids. For older kids, most resources will go through the school board. There are autism and behavior consultants that work with the school board to provide support for the kids in the schools. But otherwise, kind of just locally in a community perspective, those are the main resources. Is autism more common in boys? Yes, that was my first slide. Yes, it is more common in boys. I don't know the exact ratio offhand, but I think it's about 3 to 1. But I have patients, of course, boys and girls, and both can be severely affected, and both can have more of the higher functioning end of autism as well. I'll tell you right this, they are some of my favorite kids to see. I love having conversations and engaging with kids that are on the spectrum. They're a real joy. They bring joy to their families. I love having conversations about minutia things. If it's just amazing what some of these kids know and some of the amazing skills that they have that I think we just need to celebrate and bring to attention. So many of them, like I said, do go on in school, and especially if they're on the high functioning end, can go on to college, university, and really have rewarding careers. They may need some support in certain areas. That's absolutely true. They may need medication for some of the psychological conditions, psychiatric conditions that coexist with their autism, but many of them can lead happy and productive lives. So autism genetic, I mentioned that earlier as well. It's sort of, it's a mix. There definitely is a genetic component. We know that from twin and sibling studies. We see it in parents and children as well. So yes, there is a strong genetic component. Does autism become better or worse over time? Most kids, it becomes better over time, especially if we engage with therapy sooner rather than later. If we, even think about medication, right? So if a kid's really aggressive and they're using a lot of hands-on and physical interactions that's maybe not appropriate with other kids around them, those kids are going to draw back. They're going to say, oh man, I don't want to get close to Jared or Ian or whoever it might be, because he always hits. And so, if somehow we can calm down some of those more maladaptive and difficult symptoms, then relationships tend to improve. And like I said, I say this all the time. You'll hear this over and over again this week, positive experiences beget more positive experiences. And then that leads to more positive experiences. And we get kids on this upward spiral of positive experiences. Autism can add strain to a family. Do you have advice for parents of kids with autism to keep their own relationships strong? Yes, to help your children, you have to look after yourself too. Definitely, if you have mental health concerns, if there's anxiety or depression, you need to talk to your doctor and get help for that, and maybe engage with a counselor. Build a network of support around you. If your child is challenging, there's definitely should have no qualms about involving extended family, even for a short period of time where you can take a break, go on a date with your partner, look after yourself, get exercise, eat healthy, and that way you can really be the best parent you can be for your kids. That's true whether they have autism or not. I really believe in families as being a combined unit, and we should all be working together to strengthen families. That should be our community and society goal, is to really support families, not just nuclear families, extended families. We are, biologically wired to have extended families, involved in our lives. And so an isolated nuclear family is never as strong as an extended family. And we know that longevity and physical health and mental health is increased when we have a good network of friends and family around us. On that, maybe that gets to Elka's question there at the bottom. Thank you. What role can grandparents play in supporting grandchildren on the spectrum? Well, I think I just mentioned, help the parents out as much as you can. I give them some time away and just be understanding. There are going to be some difficult behaviors sometimes, and the calmer and more patient we can be, the less we escalate those situations. Just recognizing and being understanding grandparents can just have such a diffusing and calming effect on parents. Give the parents a break, take the kids for a day, take them out to, take the kids to a favorite place. And even if they always just want to order chicken nuggets, just go with it. Get them chicken nuggets, okay? As grandparents, if you're not like the primary caregiver, okay, that's a different situation. But if you're the grandparent who gets to take the kids every once in a while, spoil them. All right, that's your that's your job. That's what I'm looking forward to when I grandparent someday, is to take my grandparents out and really spoil them a bit. So just give them a good time, give them a break away from their parents, and then you can bring them back. Mom and dad will be refreshed, the kids will be happy, and it just generally helps everybody out. So I think that's great. Any books that you suggest? Yeah, do. Definitely some great books. There's a great chapter in a book by Bruce Perry called Born for Love about autism, just talking about the sensory issues with autism. Tony Attwood, Attwood, has written some great books about the high functioning end of the spectrum, also about girls that are on the spectrum. That's just off the top of my head. There are definitely some other excellent books out there. I'm just trying to think. Yeah, maybe I'll put some resources up tomorrow. So maybe this will be your clue to come back for tomorrow's talk. I believe tomorrow we're talking about ADHD, so that'll be an interesting topic as well. I think that's it. Anything else?
That's great. Well, I think you covered. Oh, we might have one more. Oh, we have a thank you from Shannon.
You're welcome.
So thank you so much, Rob. This was great. I think a lot of us are walking away with more information, some really great perspective on the celebration of kids at wherever they are at, and I think that's a really great message. So thank you for bringing that today. If people do have questions, Rob is here for the rest of the week. So if something else comes up, we can try and connect you with Rob and get those answers for you. And yeah, Rob, we can share those book recommendations in the chat tomorrow if you have any more that come to mind.
Yep.
So for today's session, thank you again to HDR Graham Partners for sponsoring, to Midland, Honda, and Brissett Concrete and Forming for sponsoring this entire series. And again, we have the link at the top of the chat if you want to donate to the COVID-19 Mental Health Relief Fund. And Rob, thank you so much. This was wonderful.
Yeah. We'll see you tomorrow.
Tomorrow. And thank you to everyone for coming today.